It is now my pleasure to present this year's Making a Difference Community Service Award. This award was developed to honor a person or persons who make significant contributions to their community through their time, actions, talents, and dedication. Honorees selected serve as a role model for compassion and service while striving to make the world a better place. They should have a passion for helping others within their community. Certainly, this is the case with Dr. Paul Yodice and his team, as tonight we honor them for their extraordinary work these past few months during the COVID-19 pandemic. Dr. Yodice serves as Chairman of Medicine, Director of Clinical Excellence and Effectiveness, Critical Care Medicine, Surgery, and Neurosciences. In this role, he and his team were responsible for the incredible care that each and every patient received, resulting in many lives saved. As the scope of the pandemic grew, intensive care units at St. Barnabas had to be expanded to include other areas of the medical center. In recognition of these extraordinary efforts during such trying times, the Burn Center at St. Barnabas Medical Center is honored to present the Making a Difference Community Award to Dr. Paul Yodice and his team. Accepting this award is Dr. Paul Yodice.
Thank you very much for this wonderful award. I am humbled and my heart is touched solemnly for this. The family at St. Barnabas Medical Center did amazing things through this terrible pandemic. And together we saved many lives. And together we grieved over the lives that were lost. Some of those lives lost were family members of our own. And we grieve still for them and for all the people that aren't with us any longer. But we did amazing things. And in healthcare, we devote our lives to saving those of others. But we also learned what it's like for firefighters who also devote themselves to the lives of others. But we learned something else. Firefighters devote their lives to the lives of others, but don heavy gear and walk into danger and put their own lives at risk every single day. Through all of this, we learned what true heroism is. Because we had to don heavy gear that restricted our movement. And perhaps for most of us, for the first time, had to walk into danger, not knowing if someday we would not be able to walk out again. And it made us appreciate what firefighters have to do every day of their lives. And thank God for what they do. Together, all of us did amazing things. We put together teams that never existed before, that saved lives and protected staff. We put together line teams so that we could put central lines to develop and save lives by administering medications as they became available. And we did so in a way that would protect our staff. We put together teams for intubation so we could put people on life support and keep them going and get them better and get them home. We put together teams to turn patients over so that we could get oxygen levels to safe levels, so they could buy time to get better and get those people home. And we did that because we knew we had to. And those teams also saved lives. I have to take time to mention a lot of other people who themselves led the way and made this happen. I'll miss many people, and all of them should be recognized for what they do, and I apologize to them for not naming them. But here are a few. Mike Addis, who was a leader in recognizing what needed to be done and making it happen as it needed to be done right now. Chris Freer and Eric Handler, Layla Mujic, and the ICU team that they developed in the ED. The ED, which normally takes care of people as they walk in, had to become an intensive care unit. The patients who came to our ICU were managed by Doctors Rizai and Mistry, who led the way in not only caring for patients in our ICU, but throughout the hospital, and helped the ICU doctors in other parts of the hospital make the right decisions in the toughest of times. Our PACU and recovery room and operating room and other parts of the hospital, under the leadership of Dr. Patera, and then One West under the leadership of Dr. Mark Safford, also created ICUs where they never existed before. And those patients that were cared for there also had their lives saved by those physicians. Robin Lee and Mike Morano, well known to burn patients and to firefighters for their care in the burn ICU, also became COVID physicians and ICU doctors caring for the same patients. Tim Ye and Shira Gertz in the PICU became adult ICU doctors and cared for the same. We converted floors to ICUs, and those floors were managed by our hospitalists and by pulmonologists, Drs. Fless and Dr. Kalal Patel, Dr. Raju, Dr. Avnanian. It was an amazing effort on the part of so many unnamed people. Drs. Bessler and her team of ID doctors, along with Dr. Smith, Lincoln Miller, and Peter Weiner, made decisions, and those decisions had to be changed because as new medications became available, we used them as they were necessary. An amazing effort. All of these doctors, though, could never do what they did were it not for the amazing nurses. Nurses in all of the ICUs, nurses on the floors, nurses like my niece Victoria, a new nurse who just a year ago started and put her life on the line every day. I am sure that she, like many others, never ever expected to be faced with this, and yet she did so, like all of the other nurses, because she wanted to, because she had to, because patients depended upon her at her own peril and risk. Our respiratory therapists were perhaps at the greatest risk every day of their lives because they were exposed to respiratory secretions and COVID, and yet they did so because that too would save lives. Our physical therapists, who assisted all of the respiratory therapists in administering respiratory treatments, things they had never done before, but rose to the challenge. Amazing people. Our pharmacists, who recognized what needed to be done when we were running low on something, knew what we needed to have, and made the substitutions that we needed to have to take care of patients. Housekeeping, transport, radiology. I can't think of all of the different services, all of the different people. If ever there was a time where family mattered, this was it. And they did. And they saved lives. Mike McTighe from IT kept us abreast of what we needed, what we had, where it was coming, when it was coming, and how we would get it. And I would be remiss if I didn't mention two of the most important people who solved problems faster than I could find them. Scott Curia and Brian Jankowski. These two engineers created ICUs where none ever existed before. They made negative pressure rooms faster than I could ask for them. These two and their team, absolutely amazing. I am missing so many people. I owe them my life because they protected me every day. My own family was touched by this. More members of my family than I'd care to share. But you all, you saved their lives. And for that, I can never be more thankful. And for this, I thank you. For all of us, to all of you, thank you for allowing us to take care of you. Thank you for this award. Thank you for letting me be part of your lives.